Hello, I am Dr. DeAndre. Today I will talk about the warning signs of lung cancer that you should know. Lung cancer remains one of the leading causes of cancer-related deaths globally, and one of the primary reasons for this is late diagnosis. In many cases, symptoms either do not appear early or are so mild that they are ignored or misinterpreted as common respiratory conditions, such as infections, allergies, or smoking-related irritation. From a clinical standpoint, lung cancer develops when abnormal cells in the lungs grow uncontrollably. These cells can form tumors that interfere with normal lung function and may eventually spread to other parts of the body. The lungs play a critical role in oxygen exchange, and any disruption in their structure or function can have serious consequences for overall health. One of the major challenges is that early-stage lung cancer often presents with non-specific symptoms. Patients may experience mild discomfort or subtle changes in breathing patterns, which are easy to overlook. Studies show that a significant number of patients delay seeking medical attention because they do not recognize these early warning signs. However, early detection can significantly improve outcomes. When lung cancer is diagnosed at an early stage, treatment options are more effective and survival rates are considerably higher. This highlights the importance of awareness and timely evaluation of symptoms. In this video, I will explain the most important warning signs, the physiological reasons behind them, and when you should seek medical advice. The goal is to provide clear, evidence-based information that helps you recognize potential risks early and take appropriate action. A persistent cough is one of the most common and earliest symptoms associated with lung cancer. While coughing is a normal protective reflex that helps clear the airways, a cough that lasts longer than 2 to 3 weeks without improvement should be taken seriously. In many cases, patients initially assume that the cough is due to a minor infection, seasonal allergies, or environmental factors such as pollution or smoking. However, when abnormal cells begin to grow in the lungs, they can irritate the lining of the airways. This irritation continuously triggers the cough reflex, leading to a persistent or worsening cough. The nature of the cough may vary. Some individuals experience a dry cough, while others may produce mucus. In patients with a history of smoking, a chronic cough may already be present, making it more difficult to recognize changes. However, any noticeable worsening in frequency, intensity, or character of the cough should be evaluated. Another important feature is that the cough does not respond to standard treatments, such as antibiotics or cough suppressants. This lack of response is a key indicator that the underlying cause may not be a simple infection. From a physiological perspective, tumors can partially block airways or affect nearby nerves, further contributing to coughing. In some cases, this may also lead to hoarseness of voice if the nerves controlling the vocal cords are involved. Clinical guidelines emphasize that a persistent cough, especially in individuals over the age of 40 or those with risk factors such as smoking, should be investigated through imaging studies like chest X-rays or CT scans. Early evaluation can help identify abnormalities before the disease progresses. Coughing up blood, medically referred to as hemoptysis, is a serious symptom that should never be ignored. Even small amounts of blood in the sputum can be a sign of underlying lung pathology, including cancer. This symptom occurs when abnormal growths in the lungs damage or erode nearby blood vessels. The lungs contain a dense network of blood vessels, and tumors can disrupt their integrity, leading to bleeding. The blood may appear bright red or may be mixed with mucus, depending on the source and severity of the bleeding. While hemoptysis can also be caused by infections such as tuberculosis, bronchitis, or pneumonia, it is essential not to assume a benign cause without proper evaluation. Studies have shown that a notable percentage of lung cancer patients report coughing up blood as one of their initial symptoms. From a clinical perspective, even a single episode of unexplained hemoptysis warrants medical attention. The evaluation may include imaging studies such as chest X-rays or CT scans, as well as procedures like bronchoscopy, which allows direct visualization of the airways. Delaying medical consultation can result in progression of the disease, making treatment more challenging. Early identification of the cause allows for timely intervention and improved outcomes. It is important to emphasize that this symptom should not be ignored or attributed solely to minor conditions, especially in individuals with risk factors such as smoking or a history of lung disease. Shortness of breath, also known as dyspnea, is another common symptom associated with lung cancer. Patients may notice that they become easily breathless during activities that previously did not cause any difficulty. In more advanced cases, shortness of breath may occur even at rest. This symptom can arise due to several mechanisms. Tumors within the lungs can obstruct airways, reducing the flow of air and limiting oxygen intake. Additionally, cancer can cause inflammation or fluid accumulation around the lungs, known as pleural effusion, which further restricts lung expansion. From a physiological standpoint, the lungs are responsible for exchanging oxygen and carbon dioxide. When this process is disrupted, oxygen levels in the blood may decrease, leading to feelings of breathlessness and fatigue. Patients often describe this sensation as an inability to take a deep breath or a feeling of tightness in the chest. These symptoms may gradually worsen over time, making it difficult to perform daily activities. Shortness of breath can also be associated with other conditions such as asthma, chronic obstructive pulmonary disease, COPD, or heart disease. However, when it appears suddenly, persists, or worsens without a clear explanation, it should be evaluated. Medical assessment may include imaging, lung function tests, and blood oxygen measurements. Early detection of the underlying cause is essential for effective management. Chest pain is a symptom that can be associated with various medical conditions, including lung cancer. In this context, the pain may be dull, sharp, or persistent and can vary in intensity. The pain often worsens with deep breathing, coughing, or physical movement. This occurs because the tumor may involve the lining of the lungs, known as the pleura, or may press against nearby nerves and tissues. In some cases, the pain may radiate to the shoulder or back, depending on the location of the tumor. This can make it difficult to distinguish from musculoskeletal pain or other non-serious conditions. From a clinical perspective, it is important to evaluate the duration and pattern of the pain. Occasional chest discomfort is common and often not a cause for concern. However, persistent or unexplained pain should be investigated. Diagnostic tests, such as imaging studies, can help identify abnormalities in the lungs and surrounding structures. Early evaluation allows for timely diagnosis and treatment. Patients should not ignore chest pain, especially when it is accompanied by other symptoms such as cough or shortness of breath. Unexplained weight loss and persistent fatigue are systemic symptoms that may indicate lung cancer. These symptoms often reflect the body's response to the presence of cancer and may occur even before more specific respiratory symptoms become noticeable. Cancer cells can alter the body's metabolism, leading to increased energy consumption. At the same time, patients may experience reduced appetite, resulting in decreased caloric intake. This combination can lead to gradual but noticeable weight loss. Fatigue in this context is often more severe than normal tiredness. It may not improve with rest and can significantly impact daily activities. One contributing factor is reduced oxygen levels due to impaired lung function. Another factor is the release of inflammatory substances by the body in response to cancer. Clinical studies indicate that unexplained weight loss of more than 5% of body weight over several months should be evaluated. When combined with fatigue, it may suggest an underlying serious condition. Early medical consultation is important to identify the cause and initiate appropriate treatment. In summary, lung cancer may present with warning signs such as a persistent cough, coughing up blood, shortness of breath, chest pain, and unexplained weight loss or fatigue. These symptoms may initially appear mild, but can become more serious over time. Early detection is one of the most important factors in improving survival rates. When lung cancer is diagnosed at an early stage, treatment options are more effective, and outcomes are significantly better. Individuals with risk factors such as smoking, exposure to environmental toxins, or a family history of lung cancer should be particularly vigilant. Regular medical checkups and prompt evaluation of symptoms are essential. If you experience any of the symptoms discussed in this video, do not delay seeking medical advice. Early action can make a significant difference in outcomes. If you found this video helpful, consider sharing it to raise awareness. Your awareness can save lives.